In this video, I wanted to address two vaccine questions related to pregnancy, breastfeeding, and this idea that maybe the vaccine will cause sterility. So, a question that is important to think about is, should you get the vaccine if you're pregnant, breastfeeding, or trying to conceive? And the reason that this question is difficult to answer is because there is no data on people that have been pregnant or breastfeeding with this vaccine. Here is, so last video I used Moderna's phase 3 paper. This time I'll use Pfizer's, but basically their protocols were the same. This is the Pfizer vaccine paper published in the New England Journal of Medicine. If you go through this whole paper, at the very end, there is a link to the full protocol of the study right here. If you click this link, you get this document, and on page 36 out of 376, you come to this area called exclusion criteria. And this is basically, if you have any of these conditions, you were not able to participate in their study. Like, they didn't want you in their study. And, these are kind of common sense things, like if you have some kind of medical psychiatric condition that lets you not be able to participate, if you have HIV or hepatitis, if you have severe allergic reactions to vaccines, if you're immunocompromised, you have autoimmune disease. But here's the part that is important for this question. Number 11, women who are pregnant or breastfeeding were excluded from the study. So in their study of 45,000 people, there were no women that were pregnant or breastfeeding in their study. So basically, we do not have information for pregnant and breastfeeding women on the safety of this vaccine. Now, that just because we don't have any information does not mean it's unsafe. Okay, let's be very clear on that. Saying that there's no information about safety does not mean that the vaccine is unsafe. So, since we don't know, here are some statements from the major organizations that deal with taking care of pregnant and breastfeeding women. This is a statement from the American Society of Reproductive Medicine. They say the task force does not recommend withholding the vaccine from patients who are planning to conceive, who are currently pregnant, or who are lactating. This is the CDC vaccine task force. They say if a woman is part of a group who's recommended to receive the COVID-19 vaccine and is pregnant, she may choose to be vaccinated. A discussion with her healthcare provider can help her make an informed decision. So they're saying, we don't know what the risks are, but we don't think that it's dangerous. You should not be, you shouldn't be withheld the option to get vaccinated. And you have to determine what your risk of COVID infection is versus the known side effects and the lack of data about the vaccine during pregnancy. Here's the Society for Maternal Fetal Medicine. They say, in general, the Society for Maternal Fetal Medicine strongly recommends that pregnant women have access to the COVID-19 vaccine. And they say that healthcare workers who are considered priorities for vaccination be offered the vaccine if pregnant. So same thing. This is the American College of Obstetrics and Gynecology. They say basically the same thing. ACOG recommends that COVID-19 vaccines should not be withheld from pregnant individuals who meet criteria for vaccination. While safety and data on the use of COVID-19 vaccines in pregnancies are not currently available, there is also no data to indicate that the vaccine should be contraindicated, and no safety signals were generated from DART studies of either the Pfizer or Moderna COVID-19 vaccine. So basically, these people are all saying the same thing, that there is no data to say that they're dangerous. There's no data either way, and there's no reason to believe that they're dangerous, and they don't think that the vaccine should be withheld. This is the UK's public health site. This is their version of the CDC, and they are basically saying the same thing, but they word it a little bit differently. They're saying these vaccines have not been tested in pregnancy, so until information is available, those who are pregnant should not routinely have this vaccine. So they're recommending not having the vaccine when you're pregnant, which is kind of what the American societies are saying, but kind of in a less direct way. They're saying that the Joint Committee on Vaccination and Immunization has recognized the potential benefits of vaccination are particularly important for some pregnant women. So basically, those who are at high risk. that's what these other societies are saying. Like, if you're a healthcare worker, you're high risk, then the vaccine should not be withheld from you. That's what the UK is saying. But they're saying if you're not high risk, you probably shouldn't get the vaccine. And I think that's what the American societies are essentially saying. Although they're tending to emphasize don't withhold the vaccine from healthcare workers and high risk people. And same thing about on breastfeeding, the UK Society says there's no safety or data of vaccines in breastfeeding. Despite this, vaccines are not thought to be a risk for breastfeeding infants, and the benefits of breastfeeding are well known. Because of this, they recommend that vaccines be received while breastfeeding. And this is in line with recommendations in the USA and from the World Health Organization. So basically, bottom line, there is no information because they were not in the study. Um, but there is no reason to believe that they're dangerous. They're not replicating viruses, and they should not affect the fetus. And so they are not. They're not. They're not concerned about it. So they're saying UK saying you should not routinely get it, but if you're high risk, that shouldn't stop you from getting it. So, we've been rolling out this vaccine in America, and there is this V-Safe program, which is a kind of an opt-in program that the CDC has. It's like an app for your smartphone, and if you get the vaccine, you can kind of tell them if you're having problems with the vaccine. And as of December 18th, there was 100,000 people roughly that had registered with them, and 500 of them were pregnant at the time of vaccination. So there are lots of pregnant people that are getting vaccinated at the moment. And this was December 18th. I think, we're probably up to 1 million vaccinations at this point. So this is probably at 5,000 pregnant vaccinations. So they will be keeping track to see if there's any problems with these pregnancies. I don't think anyone is anticipating problems with these pregnancies, but they are being monitored. And I know personally people at work, several people who are like anesthesiologists and ER doctors, they've made the decision, even though they are pregnant, to get vaccinated because they are high risk. And COVID during pregnancy tends to be more severe and more dangerous. So the bottom line, there is no information. Information is being gathered at this time through the V-Safe program, and here's the website for the V-Safe program. And then there's two research studies. There's this University of Washington Department of Obstetrics and Gynecology is doing a kind of a survey. If you're pregnant or breastfeeding, they want to know how things are going, and they're going to do some research on that. And there is a lab out of Mount Sinai School of Medicine where they're asking people that are breastfeeding to send them milk, and if you've been vaccinated, they are going to test milk to see if like the vaccines show up in the milk or if there's antibodies that show up in the milk, that kind of thing. Okay, so next question is, are COVID vaccines going to cause infertility? This is something that was kind of being talked about for a couple of weeks now, and this all comes about as a result of there is some slight similarity between a placental protein and the spike protein of this of the SARS-CoV-2 virus. And so this is a great blog written by this gentleman named Edward Nuremberg, and I'll link this below, and you can read this yourself. So I'll just briefly summarize it. Basically, there are these placental proteins called syncytins, and syncytins are essentially and I'll link this as well. They are a envelope protein that's present in human placenta. So if you remember from my video about can mRNA viruses affect your DNA, we talked about retrotransposons, which are in our genome. And there are these elements called human endogenous defective retroviruses called HERVs, which are a type of retrotransposon. And one of these HERVs basically encodes this syncytin protein. Okay, so the syncytin protein is in the placenta. It's in the cytotrophoblast, and it's a part of our placenta. And so without it, we probably can't. People cannot get pregnant or have without a functional placenta, you're not going to be able to carry a fetus safely to term. So if there is, if the COVID vaccine generates an antibody that recognizes this protein, then the immune system would attack the placenta and destroy the placenta, and that would result in a spontaneous abortion and loss of the fetus. So basically, if you read this, he does a blast search, which basically compares the sequence of the spike protein with the syncytin protein, and basically there is almost no similarity. The only similarity comes in this one area of 9 amino acids, with which 66% sequence identity. This is so this is 9 amino acids out of 1,273 amino acids. So it's not very large. Is it impossible that there could be epitope crossover? No, but that's highly unlikely. Um, and then also, the important thing to recognize is the spike protein in the vaccine is basically the spike protein from the virus. If you're getting a crossover reaction from the vaccine, you would also get the crossover reaction from the actual virus. And then if having COVID-19 caused a crossover reaction to this placental protein, what you would expect is to see, if pregnant women get COVID-19, a higher rate of spontaneous abortion and fetal loss. So we know that that doesn't happen. There isn't a higher rate of fetal loss with COVID-19. COVID-19 in pregnant women results in a more severe disease, but it does not result in fetal loss. So this seems to be not much of a consideration and not something to worry about. And so that's his bottom line too. That it's highly unlikely. Um, so if you're wondering why you heard that possibly the vaccine would cause infertility, this is the reasoning behind it. Was this very small amount of similarity between the syncytin protein and the spike protein of the virus. The similarity is extremely small and limited, and the possibility of crossover reaction is extremely low, and there's no evidence of it amongst the hundreds of thousands of pregnant women that have gotten COVID over the past year. So that shouldn't be a major concern. So I hope that was useful. And if you have any questions, comment below. Thanks for watching.